Presentations here. They should be short and sweet, most of them. But we want to try to get everything in and get everybody out to lunch in time. So appreciate everybody being here today for the fourth meeting of the Interim Joint Committee on State Government. Madam Clerk, if you can call the roll.
Senator Chambers Armstrong, Senator Elkins, Senator Harper Angel, Senator Mays Bledsoe, Senator McDaniel, Senator Nemes,
Present.
Senator Storm, Senator Thayer,
Here.
Senator Wheeler, Senator Williams, Representative Bauman, Representative Bojanowski, Representative Bowling, Representative Branscombe, Representative Callaway, Representative Camuel,
Here.
Representative Chester Burton, Representative Decker,
Present.
Representative Gooch, Representative Graham, Representative Heath,
Here.
Representative Heverin, Representative Herron, Representative Hodgson, Representative Huff,
Present.
Representative Imes,
Present.
Representative Johnson,
Here.
Representative Cook, Representative Lewis,
Here.
Representative Lockett,
Present.
Representative Maddox, Representative Moser, Representative Rawlings, Representative Raymond, Representative Tate, Representative Tipton, Representative Williams, Representative Witten,
Here.
Representative Bratcher,
Here.
Representative Hale,
Here.
Senator Mills.
I'm here, and we do have a quorum. I'm sure everybody has studied the minutes, so could we have a motion on our minutes from August 22? We have a motion and a second. All in favor, say aye. Aye. Any opposed? Minutes are approved. All right, first on the agenda is the Kentucky Employees Health Plan. If we could have Mr. Chambliss come up. Welcome this morning. If you can introduce yourselves, and the floor will be yours.
Well, thank you, Chair and members of the committee. My name is Chris Chambliss. I'm the Commissioner of the Department of Employee Insurance. As you all know, we are the agency tasked to administer the Kentucky Employees Health Plan. Getting started with our presentation today, I thought it would be helpful to just reorient members about the makeup of our health plan. We are a health plan administered by public employees and along with our vendors to support our public servants with quality and comprehensive care. We administer health and flexible benefit spending benefits for 300,000 people in Kentucky. Half of our members are school board employees. As we work around the pie chart there, you'll see 58% or 56% rather are school board employees. Our second largest group are retirees under the age of 65, followed by state agencies, quasi-governmental entities, and then judicial and legislative membership. KEHP is a $2 billion self-funded health plan that covers approximately 1 in 16 Kentuckians who reside in every Kentucky county. Our large and diverse membership is what gives us bargaining power to effectively negotiate bids that we get in to help keep costs down for our members. As our membership does include under 65 retirees, the diversity across membership, and including those school board members, helps keep the average age of the plan down and helps diversify out the risk pool, again, which is something helpful as we negotiate contracts. Looking at plan holder enrollment trend over time, note that this chart is a zoom in, if you will, to really highlight changes. But overall, the number of plan holders is relatively consistent year over year, with a slight declining trend over time. With the plan covering so many different employers, again, that also helps us keep our membership relatively stable. This next slide addresses all covered lives, so this would include spouses and dependents. Again, you'd see that it largely tracks the trend that we see with the plan holders. I will note that as members do get older, a lot of their dependent children will age off the plan, so that's a factor that you'll also see in these numbers. Orienting you on the next historical slide here, the red line reflects the number of claims processed by the plan year over year, whereas the blue bars highlight the total net spend in all claims paid by the plan. The plan is experiencing a higher number of claims and increased costs year over year. That really tracks what we see nationally and in Kentucky in terms of spend for other plans. As the Kentucky and U.S. population tends to use their benefits more frequently, and that the services provided and drugs provided are more expensive over time. This is our favorite slide, and the reason being is that it really reflects, I think, what's most important, and which is, are we providing robust benefits in a way that's fiscally responsible? Again, as a self-funded plan, we take in premiums to turn around and cover claims costs for our members. And here you see that the large percentage of each dollar brought into the plan is immediately paid back out to members in claims spend. And then we have smaller portions of necessary administration costs, which help with both cost avoidance programs and ensure accuracy in claims payments, which again are elements which in turn help us make sure we're spending each dollar efficiently. This chart shows year-over-year trends as a percentage in terms of spend. The plan experience here, again, largely follows national trends. We saw a pullback, especially in medical claims spending during the pandemic, followed by a rebound in 2021. Our plan was like some other plans in that we also had a somewhat of a pullback in 2022, but then saw again a rebound effect in 2023, with the largest percentage increase in 2023 resulting from higher utilization of more expensive drugs covered by the plan. So looking at expectations for 2024 and beyond. The plan is experiencing macroeconomic factors, like many health plans in both the public and private sector, with increased drug and medical spend resulting from higher utilization and higher prices for care. We will note that this increase in drug spending is at least partially offset by increases in rebates, as the plan does contract to access 100% of rebates passing back to the plan, which effectively helps us offset some of the costs of these higher, more expensive drugs. The plan is also seeing members with more chronic conditions over time, diabetes, hypertension, obesity, etc. And that also mirrors general trends with Kentucky's population and indeed national trends, unfortunately. The increase in outpatient procedures we actually view as a positive for both the plan's cost and for the member's experience, as more joint replacements and other procedures happen in an outpatient center, leading to no longer require a hospital stay. So that ultimately is a positive cost development. We also see increasing spend for behavioral health services, and we view this largely as a positive. As members access mental health services earlier, we hope that we're avoiding increased negative impacts down the road, and that members are getting the care they need to have better mental health earlier in their mental health journey. For 2024 and looking beyond, we're very proud of the fact that we haven't been required to increase employee premium contributions, and that there haven't been changes to copay, coinsurance, deductibles, or maximum amount of pocket in 2024 and 2025. I'll speak to some reasons why we've been able to offset some of those macroeconomic changes to achieve that. But I also just want to remind the members that currently we have 3 health plan options: the PPO, the consumer-driven health plan, and then a basic CDHP that offers even lower premiums in exchange for higher deductibles. In 2025, we'll be offering a 4th plan option. That would be a qualified high deductible health plan. That looks more like a catastrophic type of plan that offers even lower premiums than our basic CDHP. But as the trade-off there are higher deductibles and cost share numbers for that plan. So in an environment of rising healthcare costs, education and prevention, we believe, is critical moving forward to stem the tide of increased spending. And so as part of that response, the Personnel Cabinet has been hosting wellness fairs this year. And note that this is in addition to other vendor-supported employer wellness fairs and in addition to our benefit fairs, many of which we'll be hosting shortly as part of open enrollment. So these are specifically focused on wellness, including biometric screenings, information booths from vendors about how to improve members' health, and then also coordination with our partners at the Department of Public Health. We hosted 4 fairs in state office buildings and then 3 fairs at the correctional facilities in LaGrange so far this year. We're also focused on cost prevention programs, especially programs where we think we can provide a win-win. That would be lower costs to the plan, but also better health outcomes for our members with more robust healthcare support. And so we're looking for positive returns on investment with these types of programs. And I've highlighted 3 of them for you today. One is Hinge Health that we discussed as a new program a couple years ago in front of this committee. Hinge Health is a at-home physical therapy program that uses devices provided at no cost to members with their physical therapy and then provides over-the-phone coaching and support for that. That program, we've seen a 3.1% return on investment since program inception, and with 74% of participants achieving a clinically significant pain reduction. Now that we have a couple years of data under our belt, we're also going to be looking at whether we're going to see meaningful reductions in needed MSK surgeries. Another way to say joint replacement, spinal fusion, those kind of surgeries. But early indications are positive on that. The next program is a program that's an add-on benefit through Anthem, who's our third-party administrator, with integrated care management. This is clinical care support for members who are often facing the greatest number of significant health conditions. And it provides them access to nurses or other providers directly, direct coaching, and help with members understanding side effects and other concerns related to the most serious conditions that our membership may face. And we see with that cohort a cost trend that's lower than benchmark, which suggests a positive return for members, and also a lower medical risk score, meaning that members are managing those conditions more effectively than they would otherwise. And then lastly, I wanted to touch on our Smart Shopper program. As the members may recall, that's a program that we've had for several years that allows our members to access shared savings. If you shop around through the Smart Shopper app and choose a lower cost provider for screenings, think like an MRI, colonoscopy, those types of procedures, then the member actually gets a check back reflecting a portion of that savings, with the remainder of those savings coming back to the plan. And depending on how much lower cost the provider is, those rewards directly to members can be significant. Lastly, I just wanted to touch on our decision-making process as we consider benefit design and also these add-on programs. I'll point out that a lot of the add-on programs we've discussed, well, actually all the ones that we've discussed, but many of our programs in general are at no added cost to the member. So these are essentially programs wrapped in as part of our benefit with no added cost. But like any self-funded plan in either the public or the private sector, plan management does involve a balancing act between member needs and our fiscal responsibilities. And so careful use of cost controls and cost sharing is what helps the plan avoid increasing premiums for all members each year. And while each plan year stands alone in terms of our medical costs, and we rely on Aon and their actuarial services as our consultants to forecast costs for each individual plan year, the department, participates in the buy-in and budget process as well for administrative costs for the department. Lastly, we're constantly looking at industry benchmarks in terms of plan design and added programs, and then we work to exceed those. We rely on best practices and advice from our trusted advisors to seek out new programs that we think would be a benefit to our members. And as a whole, we've been on track for this current year's budget in terms of plan costs, and we don't anticipate any changes to what I presented to you today in the near term. So lastly, I just want to thank the membership for their consideration and support. I hope some of you are members, as are your staff, and we seek to make you proud. We hope this is a public employee plan that you can be proud of, and I'm happy to take any questions.
Well, thank you, Mr. Chambers. Thank you for the presentation. I know that your plan provides coverage for many Kentuckians, many in each of our districts, and we're proud of that plan. Senator McDaniel has a question.
Thank you, Mr. Chairman, and thanks for the presentation. You talked about clinical management and kind of monitoring to see some of the results, reduced joints, stuff like that. But when I think back on your prescription slide and the pretty dramatic increase that we saw in the last fiscal year, I'm assuming in large measure that's kind of your Wegovy, Ozempic, Mounjaro that lots of health plans are seeing increases with at this point. Is that accurate?
That's correct, Senator. GLP-1 drugs in general, including the drugs you described, was one of the main drivers of that increased spend. Yes.
So I would think that and I don't know where you're at with this, but it would probably be very prudent if we started looking at that patient population, utilizing those, and seeing amongst that population, do we see a reduction in diabetes, joint replacements, hypertension, those other things that it's kind of billed as, you spend this money on the front end for these things, reduce weight, get, blood sugars under control, and then you don't have these other issues. So, do you have anything in place now? What's the planning like that for that?
No, I appreciate the question, Senator. We have started to work on mapping out a whole program of data where we can hopefully interpret those savings, because you're right. We have a relatively short history in terms of increased spending so far. But as we look down the road, are we seeing those savings on the back end in terms of lower rates of other chronic conditions? So that is something that we're very interested in. We have started to already lay the groundwork of doing that analysis.
Good deal. Thank you. Thank you, Mr. Chairman.
Good question. Representative Camille.
Thank you, Mr. Chair. Thank you for the presentation. The information was very helpful. I had two, I think, fairly simple questions. One is, and I may have missed it, what is the average age of a member of the plan?
Yeah, you didn't mention it. You didn't miss it. I didn't mention it, but going off of memory, we're at about an average age of 38 years old.
Okay, all right, thank you. And then my other question is, on slide 9, it talks about the 2024 plan year, and the first bullet says no increased employee premium contributions. Is that just for 2024? Are we expecting increases in 2025 in premiums?
Oh, no, sorry for appreciate the question. No, so we're not going to have an increase in employee premiums in 2025 either.
Perfect.
Thanks
Thank
for
you
the
so much.
clarification. Yeah, thank you.
All righty, last call for questions. Very good. All righty, thank you for your presentation.
Thank you.
Next item is we're going to have multiple reviews of our pension systems. And next up is KPPA. If you notice, we have, for those that aren't on PPOB, we have a new face. So I'll allow him to introduce himself. Welcome.
Hello, Ryan Barrow with KPPA.
Good morning. I'm Erin Surratt. I'm the Executive Director of the Office of Benefits at KPPA.
So it's a pleasure to be here today. Been in my role for a few months now, 3 months. I've enjoyed it tremendously, and enjoyed my dozen years in the Office of Financial
Can you
Management.
pull your mic
Oh,
closer
sorry.
to you? Make sure it's on
Oh,
there.
yep.
There
I
you go.
forgot to do that. Again, Ryan Barrow. As I said, I've enjoyed the role tremendously, and happy to present today. These are the topics that we were asked to cover: the year-end investment returns, the cash flows of the systems of the various plans, the most recent actuarial studies. Now, those are a little stale. They're June 30, 2023. We expect, statutorily, we have to have those done by the 15th of November. Traditionally have those done in the beginning of November and available for board adoption and public consumption. And then the legislation, going to cover the two bills. Neither are material this session, but we have those for your consideration today, or preview is maybe a better word. And then Aaron's going to cover some federal legislation that affects the health plans. So jumping into the highlights of the investment returns, all plans exceeded their actuarial assumptions. So that actuarial study that we have in November, it's going to have better performance on the investment side for all the plans. The top decile risk adjusted, the Sharpe ratio, which is just an adjusted return for factoring in risk, are within the Wilshire peer universe over the 3 and all the 5-year periods. And then asset allocations have recently changed. Both the C and the K have taken action recently, and the investment staff has worked to put those new targets, new ranges for the asset allocation in the portfolio. So moving on, apologize, we do have a lot of numbers today. I'm not going to try to read anything to you, but this is the pension returns, and you can look down the fiscal year to date. And I always start on the right side of this chart is the actuarial assumed rate of return. As you can see, for all periods in the fiscal year, that has been exceeded. And that'll have strong performance that we get in that actuarial study. Fiscal year to date, and in the 3 years, there's a slight lag of the benchmark. And the 5-year on, it's at or to the benchmark. I'll just mention in the short term, private equity and public equity have had just giant returns. And there's 2 reasons that we're a slight lag in the short term. One is, we've all heard of AI. There's basically 7 names or 7 entities that had large returns, disproportionate in the public equity space. We, due to diversification, do not allow large concentrations in individual names. So there was some lag when you have a small segment, small asset class with large returns. And then on the private equity, our benchmark it's being discussed with the boards, but there's somewhat of a short-term mismatch where it doesn't take a private equity or a private equity index. It actually takes public equity index and adds 300 basis points or 3% on top of that as our benchmark. So with very strong returns in the public equity, and then just benchmarking one asset class off another, there is some slight returns there. And that's demonstrated in these returns for the pension plan, as well as the investment. So slightly better returns on the fiscal year-to-date numbers, again, exceeded all the actuary assumes rate of return, and all of them in the short term or over the fiscal year were double-digit returns. So moving into the cash flow side, just to give you the highlights, We're working on 2049 for fully funding all the plans. All plans, as you would expect, considering their funding ratios, had positive cash flow. Insurance is a little bit different. They're very mature. Most 3 of the 5 are fully funded, meaning over 100%. So as would be expected for a more mature, higher funded plan, most of those did not have, or some of those did not have a positive cash flow. But again, from my perspective, that's not a huge concern because, again, as your funding status increases, you have more assets to invest and you have larger returns factoring in there. So moving to the cash flow with the K non-hazardous, member contributions were up really across all 3 of these plans, the K hazardous, non-hazardous, and state police. I'd like to draw your attention to the general fund appropriation line right in here. Thank you for those additional appropriations. Has a large impact to the plan, goes directly to mitigate some of the unfunded status, and then it's compounded at the returns that we just saw on the previous slides. So there's a compounding effect. It makes a big difference, and I believe we'll see that in our fundings from GRS, the actuarial studies as well. Better performance, but obviously the excess funding that's demonstrated in the non-hazardous, and state police has previously received some as well. So what I go to on this is the net flows. So we have positive cash flow on the net flows just below the second red line there. Obviously, the CRS non-hazardous has a large positive cash flows because of that supplemental funding, which we were very appreciative. But the same is true for the hazardous and the state police plans in terms of positive cash flow. Moving over to the C side, the CRS side, we have this similar story. Membership contributions are up, total inflows are up, with positive cash flows for the CRS non-hazardous, $151 million, and the hazardous just over $106 million. Moving to the insurance side. So as we said, more mature, higher percent funded plans. The non-hazardous is about 81% funded, but the 2 others on this slide, the hazardous and state police, they're north of 100% funded. So therein lies where we see the hazardous. There is a negative cash flow there. State police is essentially close, just above positive, close to break even. And CRS non-hazardous at about 82% funded, obviously requires. That's on the next slide. I apologize on the funding status. It's just the way I always think of things in terms of cash flow. The funding status has an effect. Yes, sir. With the positive cash flow in the non-hazardous. Moving to the C side. So both of these plans are over 100% funded. So we do see, negative cash flows, 24 for the non-hazardous, in fiscal year 24, a negative 2.4. And in the hazardous, we have a negative cash flow, net flows as well. But again, it's over 100% funded based on current actuarial rates. So thank you for the lead in on the actuarial statistics. We will start with the pension side. So I think we all know that the KRS non-hazardous is, the one that has the most funding challenges. As of June 30th, 2023, we were just about 22%. And then the balance of the plans range between 51 to 65%. So obviously in the new actuarial study, we'll recalculate these as of June 30th, 2024. With, I think, given just the investment returns we just mentioned, we'll have a positive experience on the investment side, attributing to higher funding ratios on all the plans. And then Aaron's going to talk a little bit about some of the stuff that's happened on the medical side that will put some cost pressure on the plans. But in terms of the KRS non-hazardous, that is the one that's roughly 81% funded, with a balance north of 100%, with as much as 170% in the KRS hazardous side. So the two bills that we are considering running, that thank you for the ability to have a preview today. The first is just a reorganization. As I think in most public and private entities, the CFO essentially is at the executive level. That is not currently true for us. We would like to rectify that and make the CFO at the executive level. And then that the group that reports to the CFO, the Division of Accounting, essentially two core functions. One that does accounting for the agency, for KPPA, and one that does more investment accounting. They're drastically different individuals, different groups of people, to split those two out. And the last is really a derivative of a Kentucky Court of Appeals opinion. So on pension spiking, that across-the-board raises and increases in credible compensation given to all employees in a specific class doesn't trigger spiking. And that was as I said, the Kentucky Court of Appeals, that cited those across-the-board raises. That's a professional advancement, bona fide promotion of a career, and doesn't constitute pension spiking. So with that, Aaron is going to cover the federal regulation side.
Thank you. Yes, we'll just go over a few of the federal legislations that are going into effect that will have some impact to the insurance plans. The bottom line, these new laws that are going to effect improves the pharmacy benefits for the beneficiaries or our retired members, which basically translates into higher premiums for the plans as a result of those increased benefits. Some of the key changes with the Inflation Reduction Acts that are going into effect in 2025, it caps the beneficiary out-of-pocket spending at $2,000. Currently, that's $8,000. It's being reduced to $2,000, and there is an option to smooth the cost at the point of sale for members for pharmacy benefits. So they could, at the point of sale, pay $0 for a prescription and smooth that cost out over the 12 months, paying a monthly payment for that. Also, the accumulation towards the cap, towards the $2,000, is based on incurred costs. That's not actual out-of-pocket spend. It's incurred cost. And there is a new shared liability established in the catastrophic phase of Part D Medicare. So those are the changes that are going to have some impact to the planned premiums. GRS, our actuary, did provide a schedule of some potential changes to the plan funding status based just on these premium changes. It didn't include any of the other gains or anything or losses that would occur during the actual valuation process. But just to give you a preview, the change in the premium will reduce the funding ratio anywhere from about 6% in SPRS up to about 14% in the CERS non-hazardous plan. So still those plans would stay roughly around 100% funded, except for the KERS non-hazardous. The SBRS would be around 95% funded, and the CRS hazardous about 96% funded. The other two that are currently over the 100% would remain over the 100%.
So are those year over year reductions, percentage reductions, next year in the on insurance for the prescription benefits?
That's a one-time.
Yeah,
One
that's just
time.
for the.
Yep.
Okay.
Yes.
I have to comment on the title of that page is Inflation Reduction Act. It doesn't quite seem to be that. We have some questions. Representative Johnson.
Thank you, Mr. Chair.
McD.
Hey, guys.
Hi.
Hello.
So one comment and one question, if I could, sir. And my comment is back to the pending funding status, and we don't have to go back to the slide, but the numbers are trending up.
Yes, sir.
And compared to what they've looked like in previous years, they look good. But I just want to caution the committee that just because they're trending up and those numbers are better, they're not where we need them to be yet. Typically, the financial world looks at 80% as a good funding level. We're not there yet, but we're getting there. So I would just encourage the committee to remember that we do need to stay the course with respect to trying to get these funds where they need to be. And then my question is about insurance funding, the funding levels. And I'm not trying to put you on the spot, but maybe I am. I don't mean to. But with the funding, those funding levels getting at 100% or higher, would you see, or would you like to comment, project, preview what will be done with those funds when they're above 100%? Maybe premature to talk about that, but I think it's worth bringing up for the committee's sake.
Well, I'll start with a couple thoughts and then go to Aaron. So as we just discussed, some of these will now go below 100%. And on the insurance side, they're very volatile. There's large impacts to the federal legislation, regulation that can immediately take these from what would be considered by most to be excessive funding to below funding levels.
I don't have anything to add. I think you covered that, Ryan. You covered it well.
All right, thank you. And I'll just add to that. I kind of expected that, but when we see that we've got money over and above, our eyes tend to light up a little bit more, and we get a little excited, and need to remain cautious about that. So, thank you, Mr. Chairman.
Representative Lockett.
Thank you, Mr. Chairman. I just kind of want to actually piggyback on what was just said with a question and kind of a clarification. You mentioned that on one slide, you mentioned that in 2049 that it was projected that all of these would be fully funded, correct?
Sir.
And then on a different slide, it was 22% funded. So my question, kind of a two-part. One, those numbers are 2023 numbers, correct? Did you say that?
Yes, these are June 30th, 2023.
Okay. Do you have any anticipation in terms of how those will change, either funding level from 22% up, given the returns and investment this year? Any type of projection in terms of where that will be?
So on the pension side, we anticipate the funding ratios to increase. There will be a variety of factors. One is we talked about in the beginning of the presentation, the better performance on the investment side to the assumed rate of return. So we anticipate those all. I'd be hard pressed to give an amount or anything until the actuaries produce the numbers. So that's on the pension side. On the insurance side, we expect the ratios to decrease because of the Inflation Reduction Act that Aaron went over.
Okay. And so on the 2049 fully funded, is that under the assumption that everything from now until then remains the same, whether it's funding from the General Assembly, whether it's returns, whatever? What goes into to say we expect this to be funded by 2049?
So that is the basically paying the normal cost and then the unfunded liability. It's calculated different between each plan, but basically you're catching up for contributions that are not in there to pay the benefits that is accrued. So paying the ADEC, the actuary determined contribution, over that amount of time, assuming the assumptions are not widely off, that it will be fully funded in 2049. And when you just parse out the one statement, assuming everything's the same, there has been supplemental funding that can, decrease that, meaning it could happen sooner. But I'm just answering specific to the ADEC. Yes, it will pay off the normal and the unfunded liability to 100% ratio, assuming all actuarial assumptions are correct, in 2049.
Right.
Yes, sir.
Thank you.
Senator McDaniel.
Thank you, Mr. Chairman. And Ryan, great first 3 months, right? Just keep this pace, and we'll be funded by 2034. No, but in sincerity, it does look good, and the good thing is, meetings and presentations like this are progressively becoming more and more and more boring, which is what they should be, right? when I first showed up here 12 years ago, these meetings were not very boring at all. There was a lot of panic. There was a lot of worry. And the fact is, the actuary had not provided good enough information to let us know exactly how much worry we should have had. Because as we found out in the first couple of years of dealing with this, it was even worse shape than everybody thought. And it was supposedly as bad as it could get at that point. In large measure, thanks to Senator Thayer and his leadership, along with Representative Cherry and the reforms that they put into place, we get to have boring pension meetings where you talk about things moving in the appropriate direction. And of course, you can't make comments like that without also talking about Brad Gross and the work that he's done. You know, the number of things that we've passed, he's drafted 15 times more bills than that haven't seen that. But I want to make that statement because even for those of us that were here, I see several faces that were, and they won't be back in the next session. But this is a long-term discipline. You know, as you said, we're still 25 years out from this thing finally getting where it needs to be. And it's been 12 years of hard work to get it where it is now. And so we look forward to your steady guidance. We look forward to the ongoing discipline of the General Assembly and realizing that sometimes that's not always easy, but it is necessary, and we'll get where we need to be to honor the commitments that we have made. And so with that, thank you, Mr. Chairman.
Representative Hodgson.
Yes, sir. Thank you. Looking back about 8 years, I think my first conversation with Dave Eager, we were about $60 billion in the unfunded liability hole. And about a year ago when Dave was talking to us, we were down to about $40 billion, which great improvement, on the right track. And as if I add up the numbers on your slide now, it looks like we're in total about $20 billion underfunded. Am I reading that right? I mean, that would be a dramatic improvement from Dave's last report to this report, from $40 billion underfunded to $20 billion underfunded.
Well, these are the June 30 numbers, so I'll leave Dave's numbers to Dave. But yes, there's been progress. And again, we hope when we release these in November to even be improved on the pension side. Yes, sir.
Okay, so but I'm getting that total about right. It's about $20 billion of our total unfunded liability
Yes.
here.
Mm-hmm.
Okay. Thank you.
Our final question is Representative Bratcher.
Well, I was just going to ask your opinion on a couple of quick things. And number one, the economy is so much a part of this calculation. And since you've been in, the economy has been good. And as far as the investments go, there's all been on the uptick. If it turns on the downtick, are you ready for that? Are we ready for that? Just your opinion on that.
Yes, sir. So the assumed rate of return, which is always the topic amongst the board and the investment committees. So that assumed rate of return is a 30-year outlook. So as we reported on the first couple of slides here, we're exceeding that. So you'll have periods where you would exceed it. That the thought being is that is the experience over 30 years. So that's why we don't constantly recommend raising it to the boards, because we understand the investments are not going to be as strong like this going forward over a 30-year period.
That's all I want.
Yes, sir.
Very good. We had some good questions, good comments here, and thank you all for your presentation. We'll see you next month.
Thank you.
And while they're leaving, and then Bo Craycraft is next, I'll mention there was a regulation that KPPA was wanting to amend, and you'll get some information via email this month before our next meeting, and we'll discuss that amended regulation. And we've got a couple questions we'd like for them to answer, and we'll get the answers to those questions emailed out to all the members so they know what is going on. All right, Bo Craycraft, you're next. Judicial Forum Retirement.
Well, good afternoon. Again, for the record, my name is Bo Craycraft, and I'm the Executive Director over at the Judicial Forum Retirement System. It's really good to be here, and I appreciate the opportunity to present, and really appreciate your time. Much like Mr. Barrow, I've been asked to provide just a general update on our investment program, recent performance, how the funds are allocated, as well as an update on actuarial and cash flow related topics. Before I jump into the slides, I just thought it might be worthwhile to do just to real quickly spend a little time and just highlight our agency. It's been a while since we've presented before this committee, and I know several of the faces I recognize from PPOB, and so they have some awareness of our agency. But, you just heard from KPPA. You're going to hear from the teachers' retirement folks after me, and we're this little agency in between. And we do things a little differently, and so I just kind of thought that would make sense. And so the first thing I want to highlight is we're smaller. We're smaller both in the number of members that we have. You're going to see that our asset totals are smaller. We've got a smaller group of staff. And so as a result, and specifically as it relates to some of the topics that we're going to discuss today, our board has taken a slightly different approach. Most notably is with regards to how we invest the plans, both the approach that we utilize, but also the strategy that we employ. First, from the approach side, KPPA and TRS, they have very talented investment professionals on staff who help coordinate the assets. They manage some of those internally. JFRS, on the other hand, is stuck with me. And so the board, very rightly so, and the investment committees have decided to partner with someone way smarter than me, and that is Baird Trust Company. And so Baird Trust Company acts as our sole investment provider. They have discretion over the investment of the assets in accordance to an investment policy that our board sets. And that relationship dates back 30 plus years. They were formerly known as Hilliard Lyons, and almost all of our team is located here in Kentucky. They have a significant presence in downtown Louisville. Our board meets there once a year for one of their quarterly board meetings. And so that's, first and foremost, that's a kind of a unique difference between the way we operate from an investment perspective compared to our two larger counterparts. And as you're going to see, the relationship has been one that has benefited not only our plan and our membership, but it's also benefited you all as stakeholders on the employer side because, the better our investment performance is, it puts some downward pressure on the amount of funds that we have to request from the employer side. The second thing I wanted to highlight specifically with regards to investments is the strategy that we employ. I know I've made reference to this a couple of times at the Public Pension Oversight Board, but I often coin it, we are aggressively conservative. We're aggressive in the sense that when we get to the asset allocation and when compared to the way that KPPA and TRS invest, we have a significant allocation to equity, specifically U.S. equity. Which by almost any measure is the most volatile asset class, right? I know any of you that have personal investments, you can look quarter to quarter, and sometimes they can bounce pretty significantly up or down. And so we're fairly aggressive in that allocation. On the other side, we're pretty conservative in the sense that we don't do a lot of what you would call alternative investments or things that are a little bit more illiquid or have a longer investment horizon. And we also only invest in the United States. We don't currently hold anything outside the United States. And so it's a different strategy and, very upfront. It's not something that our counterparts can do. Mr. Barrow just referenced the amount of assets that they have. They can't take that level of concentration. They have to diversify the assets. So this is one of those spots where being small is a benefit. And we do have the ability to do it. The other side of the coin, and really the driving factor of why this has worked for our plan, is that historically we've had a good cash flow position. And what I mean is we've been able to manage our cash flows and take a very long-term approach. And so the basic tenet of this strategy is that our board believes that over a 15 to 20 year period, the U.S. market is going to outperform other markets. This is very similar to what you may have heard a Warren Buffett type approach to investing, or a Berkshire Hathaway, which is Warren Buffett's investment arm. But the argument is that if the U.S. economy and the U.S. We're going to continue to be a global leader in this world, then the underlying companies that call us home must also be successful to fuel that growth. And so the argument is that if we can weather those periods of underperformance that you just mentioned and take a 10 to 15 year time horizon, then we believe over time the U.S. economy will win. And so that's proven to be pretty successful. It's not always, it's not fail-proof. In fiscal year 22, we reported and we had negative returns. But again, if you're able to weather the storm, and in the case of Baird, many times they've been able to take those opportunities to add to existing positions when they've been maybe overly devalued, and then you get the compounding nature on the way out of, or on the way up from a recovery. And so that's kind of a long-winded introduction just to kind of set the stage, because we do things a little differently. And as we look at asset allocation and performance, that will help drive some of the discussion. Slide 2 gets us started with a snapshot of the portfolio allocation. As I mentioned, we do have a healthy allocation to U.S. equity. Our target is 70%. The other 30% is targeted to intermediate credit or cash. The equity, again, is benchmarked to the S&P 500, so it's large cap U.S. equity predominantly. The fixed income is more intermediate. It's not very long term as far as maturities are concerned. It's a mix of corporate, very high quality corporate credit, and then we also have some government U.S. Treasury, things like federal home loan bonds that are in there as well. Baird Trust, as our sole investment provider, does have discretion to kind of move up and down this target 10%. So you can see that reflected in the range. Historically, they've stayed somewhere between a 5% range. When the equity markets have really accelerated, there's been periods of time where we've gotten closer to that 10%, but they generally, through their rebalancing practice, keep us somewhere, between 70 and 75. As you can see, at the end of the fiscal year, we were pretty close to target at just under 72% equity. So we're invested 70% equity, 30% fixed income. And so as we move into a slide of performance, before you even talk about performance, you can kind of get an idea that our results are going to be largely driven by what happens in the equity markets. We have 70%, or 70 cents of every dollar invested in that asset class, then how that asset class is going to do is going to really drive. And Mr. Barrow kind of stole my spoiler alert, but as we know, equity markets have done very well here recently. And so when you look at performance over both the fiscal year and even beyond, you can see that our performance has been pretty successful. Now, from a performance standpoint, our board really evaluates performance 3 ways. We look at it from an absolute point of view, a relative point of view, and then relative to our actuarial assumptions. The first question, we're going to ask is, did we lose money this year, or did we make money? From an absolute point of view, the goal is, of course, is to make money every year. That's not always the case. Investing, there's no fail-proof approach to investing, and so there are periods of time when we will lose money. We saw that in fiscal year 22. The S&P 500 was down over 15% that year, and so our returns for that fiscal year were down around 10. This year's a better picture, right? Equity markets really accelerated. We were up 25% for the 12-month period, and so our returns are reflected as 20% for our plan. But that's kind of the first thing they ask. The next question the board will ask is, how did we do relative to our benchmark? And so we have a performance benchmark, and what that benchmark really does is it kind of gives us a hurdle or kind of a target. It asks the question, it answers the question of, if you had invested these funds exactly as you had planned, what return should you have received? And so, for instance, for a 3-year return, our benchmark return was 6.8%. That says, hey, if you had 70% exactly in S&P 500 and 30% exactly in intermediate gov credit, you would have earned 6.8. And so we compare that number to what we actually earned. And so we want to say, how did we do relative? And in the case of like a 3-year return, and as you look out over the 5 and longer, we've been able to outperform our benchmark in all of those trailing time periods. That's largely driven by a couple of things. One, as I just reflected on the slide before, we generally have a little overweight to equity. And so again, we believe that over a 15 to 20 year period, equity is going to win. And so having an overweight to that asset class will add a little bit of excess return. But more importantly is if you look at the underlying performance of Baird, they've done a very good job from a stock selection standpoint. They have a goal to outperform the S&P 500 significantly, and they have been able to do that over the long term. And so those two combinations, both an allocation but also a stock selection, has led to that outperformance. And then the third thing we do is we look at the returns relative to how what we're making from an assumption standpoint on the actuarial side. Our board and our investment committees for both plans have assumed a rate of return of 6.5%. Now, you asked the question, Representative Bratcher, about are we prepared for potential downturns? One of the things that the plans do to try to help smooth against those periods is we smooth the gains and losses over a 5-year period. So, for instance, this year we earned 19.4%. That's roughly 13% more than our assumption, but we don't recognize all of that in 1 year. We recognize 20% of that. And then next year we'll recognize 20%. And the argument there is that we can smooth the gains and losses so that you don't see significant increases in employer contributions or significant changes in funding levels up and down year to year. And so I like to look at the 5-year number just to kind of get a gauge of where we're at from an actuarial standpoint. It's not exact. This is a compounded number. The actuary is doing just a 20% recognition each year. But as you can see, for the 5-year, our plans are somewhere around 12%. So that's at least an indication that we should have some gains that we're going to be able to recognize going forward from an actuarial standpoint. So that's really all my comments with regards to investments. So we'll turn our attention to actuarial information. Much like KPPA, our results are a little bit stale as well. We're currently in the process of doing 2024 valuations. We only do a full funding valuation every other year. We do those in the odd years leading up to the budget process. And so our most recent was effective July 1, 2024, or I mean 2023. And so that's what is reflected on this slide. This is just a high-level view of the two plans, and then I have a couple of slides that dig a little deeper. But just to draw your attention really to just two things. First is the funding level. That's in that first kind of gray shaded box in the middle of the page there. As of 2023, all 4 plans had reached full funding status, which really just means that the total liability, that the actuarial asset value exceeded the total liability. And then the bottom half just reflects contributions and for what we requested for the most recent budget that was passed in the 2024 regular session. And as you can see, there was a very small ask with regards to JRP, while the other plans did not have an employer contribution requested. I also have included membership on the right side just to try to give a sense. The cash balance plans were introduced in 2014. They are continuing to grow. It's a process. And you can see that they're growing and kind of taking a larger piece of that pie. But when we get to the actual liability and dig a little deeper, you're going to see that almost all of the liability for these plans is still being driven by the legacy tier of benefits. Slide 5 and 6 take a deeper dive just in the 2 underlying plans. I didn't really plan to spend a ton of time on either one of these slides, but we'll just highlight 2 things. One is if you look at the value or the asset section, which is that middle column, you can see the actuarial value of assets, and then it is compared just under to the market value of assets. Again, this is another indicator that you can kind of look at to see with regards to any potential gains or losses. In this particular case, you can see that the actuarial value of assets is less than the current market value. And so again, that's just an indicator that hopefully that we should have gains left to recognize going forward in the valuation. And so we should have some level of positive experience there. The second thing I'll point out is if you move to the far right and look at the accrued liability, just under that larger blue text, you can see almost in all plans across both plans, the legacy tier accounts for 99+% of the liability. So that was just to reflect the comments I made prior with regards to membership. Next is cash flow. This chart is a comparison of the most two recently finished fiscal years. Again, it's a little busy, so apologize for that. I'll just draw your attention to the gray shaded box to begin. As when KPPA just presented, they reflected a significant level of employer contributions, and they pointed out that they had a positive cash flow. We're on the other side of that spectrum, right? We're not requesting a ton of funds from the employers, and so we are experiencing some negative cash flow. What that means is that we're paying out more in benefits than we're receiving in contributions. Now that's in personal finance. If I were spending in that manner, I would probably get a nice little reminder from my wife, because that's not something you want to do long term. But with regards to in the public pension space, that's not necessarily a sign of unhealth. And in a lot of terms, it's a sign of health, right? You're not requesting as much money, and so you're spending some of the assets that are currently on hand in the fund. Now, the question really becomes, for our board and for myself, it's really not a question of whether or not we can make pension benefit payments, right? We have assets on hand. Really, the discussion becomes more about, can you manage that cash flow? Can we continue to invest in the manner that we just discussed earlier, right? We want to take a long-term approach. We want to try to be able to weather periods of underperformance in the U.S. equity market. And so the question really becomes more, can you manage? Most actuaries would say, and I know the PPOB has heard testimony, that plans can handle somewhere around a negative 5% cash flow. You can see reflected in our chart that we're somewhere around that 1.5% to 2%. And so we've been able to manage it. We've been able to kind of structure our bond portfolio and schedule maturities so that bonds are maturing kind of in a timely fashion. And then we've also taken advantage of when equity markets do kind of rip, we've been able to rebalance and hold some of that cash for the purposes of meeting future benefit payments. My last slide is very similar to the slide you saw from KPPA, and I will fully acknowledge that Aaron and Ryan are way more educated than me with regards to this, and so I really will just echo what they said. The Inflation Reduction Act is having a significant impact. We're expecting our premiums to increase somewhere around 35%. And so that's going to definitely put some downward pressure on our insurance funds, which are considerably smaller with regards to the size of assets. And so we do expect, I don't have any projections like KPPA has just yet, but hope to have those here in the next couple of weeks. But do expect to see some decline on the health insurance side. Other than that, that's really all the comments I had. Again, it's really appreciate the time and happy to answer any questions.
Representative Johnson has a question.
Thank you, Mr. Chairman. Very briefly, just for general information, the judicial plans, who exactly is in those plans? Is it like court clerks or just judges or just judges?
You have to be elected or appointed to one of the district, circuit, court of appeals, or Supreme Court positions.
So the staff is CERS, is that correct?
KERS. I think they're K.
I think there
Head
would
nod.
be K. I think they're K. I think they're
KERS?
they're considered kind of an employee of AOC.
Okay.
Yep.
All right. I just wanted a general knowledge there. Thank you
No,
very much. Thank
no,
you, Mr.
limited
Chairman.
membership, both with judges and legislators, right? So that's the other unique thing is, our membership really can't grow beyond a certain point because there's only a limited number of seats.
Thank you.
All righty, you're one question. You got off easy.
Thank you.
Appreciate your presentation. It's always good to catch everybody up that's not on PPOB, for sure. All right, final presentation. Mr. Bo Barnes. He stands between us and lunch. No pressure. Yeah, no. This is an important presentation for us to be able to answer questions for teachers when they ask us all these tough questions. So, welcome. Thank you.
Thank you, Mr. Chair. Let's see, here we are. That doesn't look quite right. Can you all see that all right? Okay. Good afternoon, everyone. My name is Bo Barnes. I serve as Deputy Executive Secretary and General Counsel for the Teachers Retirement System. I will try to be as quick as I can, so some of these slides I'm just going to touch on very briefly, not go into detail, but certainly would happy to take any questions there might be. The first one, and this is the most important slide in the presentation today, and it's wonderful news, and that is funding. The budget that was just enacted in 2024 provided TRS with now 10 straight years of full or very, very nearly full funding for the pension fund. This is fantastic news. It's something that, as many of you are aware, for many years we were not getting full funding for the pension fund. So I know staff at TRS, I know teachers across the Commonwealth are very thankful about this additional funding, this full funding, and we talk about it all the time when we go out and meet with them, and everybody's very excited about it. We got full funding for the Health Insurance Trust, too, in this budget, as we have been for a number of years. And then also, just real quickly, on top of all of that, this budget appropriated an additional $80 million for the Retirement Annuity Trust over and above what we even requested. So just great news, and I just wanted to touch on that because it is so important, that funding, what it means for the teachers' retirement system. Investment performance, unaudited preliminary numbers, but they're not going to change a whole lot. I'm going to focus on the bottom two rows, and I'm going to start with the numbers to the left, the percentages to the left, and this is for all time periods for the quarter ending June 30th, 2024. And you can see for that quarter, that those 3 months, the return was 0.88%, which placed TRS in the top 55% in the nation when compared with other large public pension plans with $1 billion or more in assets. Go to the right of it, that next column, the 1-year return, we had a return of 11.93% in the nation. I will point out that the second consecutive year that the Retirement Annuity Trust has earned returns of double-digit numbers. And that places us in the top 10% in the nation compared to other large public pension plans. The 3-year period, and it's 3.22%, and as Bo Craycraft noted, we got one bad year in there, 2022, but that will roll off, and you'll see that percentage go up. But we're in the top 41% for that 3-year period. For the 5-year period, returns were 8.5%, puts us in the top 12% in the nation. For the 10-year period, returns were 7.66%, which places us in the top 8% in the nation. 20-year returns, 7.42% returns, and for the 20-year period, and we don't have comparative data for the 20-year period. And we are a long-term investor. We take a long-term outlook. You heard Bo Craycraft talk about 30-year numbers and others. So 8.1% return over a 30-year period. Our assumed rate of return for the Retirement Annuity Trust is 7.1%, so beating that over the long term by a percentage point. The next slide, same thing, but for the Health Insurance Trust. Again, unaudited preliminary, and then going there to those bottom percentages, bottom one, actually. I'm going to focus on the bottom one here because we don't have comparative data with other public pension plans for the Health Insurance Trust. But focusing on that bottom row, for the quarter, returns for the Health Insurance Trust were 1.59% for those 3 months. For the 1 year, 12.4%. Also the second consecutive year of double-digit returns for the Health Insurance Trust. 3-year period, 4.24%. 5-year period, 8.74%. 10-year period, 7.1%. And our assumed rate of return for the Health Insurance Trust is 7.1%. Cash flow. Okay, and some of you on all of you on PPOB have seen this slide format many times. So what this shows is the cash flow for the Retirement Annuity Trust, and again, preliminary and unaudited still at this point. And this slide you can kind of break down into thirds. The top third represents cash inflows. The middle third represents cash outflows, and the bottom third of this slide just reflects what resulted from those cash inflows and cash outflows. Looking at the second column from the left, you see FY24. So that's information for the fiscal year as of June 30th, 2024. Just to the right of it, you see the year prior. That same information for fiscal year ending June 30th, 2023. So focusing on that top line, you'll see for 2024, we had member contributions of $383 million, an increase from the previous year, which was $366 million. Employer contributions and appropriations, $1.176 billion in fiscal year 24 compared to $1.144 billion for the previous year. Investment income, this is going to be stock dividends and fixed income interest. We'll see $419 million for 24 versus $382 million the prior year. Total cash inflows, almost $2 billion, $1.978 billion for fiscal year 24, up from $1.893 billion the previous year. So those are the cash inflows. Now going to the middle section, there's really two lines here with cash outflows, and the biggest part of that is going to be the benefits being paid out and also refunds of account. But overwhelmingly, these are the benefits we pay out every year to retired teachers. And you can see those benefits that were paid out in 24 were $2.499 billion compared to $2.418 billion in the previous year. We had administrative expenses, the other item with cash outflows, $15 million for fiscal year 24, up slightly from the prior year of $14.5 million. Largely, that's a 6% across the board pay increase ordered to all state employees. Also had some IT projects that we were working on as well. So total outflows, $2.515 billion for 24 versus $2.432 for fiscal year 23. Negative cash flow is $536.5 million for 24, $538,900,000 for 23. As you've heard others talk, negative cash flow is something that is expected in a mature plan. Our negative cash flow is about 2%. You heard Bo say, you're okay up to about 5%, Bo Craycraft. So we're well under that. At one time, that negative cash flow was much higher, and it was getting higher every year until we got the additional funding that we're getting now, which lowered that negative cash flow to a very manageable level. So again, very appreciative of the additional funding. Just below this, and this is sort of the rest of the story, this is very important because you look at cash inflow and cash outflow, it leaves out something very important to the story, and that is investment gains or losses, realized or unrealized. Realized, you sold stocks or you sold some asset class during the year. Unrealized, you still have those stocks or those assets, but they've increased in value. And you're going to see the net impact of that in these next two lines I'm going to talk about. But anyway, the investment gains or losses for 2024, $2.381 billion, up from the previous year when they were $1.883 billion. Now, what does all of this mean for the assets of the system? Well, let's look at the second row to the right, from the right, in the bottom two numbers there. You'll see that the net plant assets as of June 30th, 2023, $24.244 billion, increased by about $1.8 billion to the end of the June 30th this year to $26.088 billion. So even with negative cash flow, the corpus of the trust grew over that 1 year period. Next slide is the same information for the health insurance trust. They're separate funds. You have a retirement annuity trust and you have a health insurance trust. So same format. I'll start at the top line there. You'll see member contributions increased in 2024 to $217 million from $212 million the previous year. Employer contributions increased also from to $232 million in 24 compared to $208 million in 23. Recovery income. These are drug rebates that we get, and our staff spend a lot of time making sure we get all of our drug rebates that we're entitled to for our prescription drugs for our retirees, and also, very importantly, federal subsidies. So recovery income increased to $153,800,000 in '24 from $145,400,000 in '23. Investment income, same as before, we saw an increase to $51,100,000 in '24 from $31,700,000 in '23. So the net, the effect of all of that is the total cash inflows were $653,100,000 in '24, up from $598,400,000 in the previous year. Now going to the middle third of this slide, we see the cash outflows. We see benefits went up somewhat they were $353,400,000 in '24, up from the $333,600,000 in the previous year. Administrative expense for the health insurance program that we run, $2.1 million, up just very slight from the $2 million the previous year. Total cash outflows, $355,500,000 in '24. Down slightly from $335,600 the previous year. Now you'll note here, of course, we just saw the previous slide where we had negative cash flow. It was manageable at 2%. Actuaries are fine with that. Our investment team is fine with that. But this is positive. The cash flow is positive for the health insurance trust, unlike the retirement annuity trust, as a result of that historic 2010 legislation. It's called share responsibility. It is legislation that changed the health insurance benefit from a pay-as-you-go benefit, pretty much just dollars in, dollars out, and a benefit which the Commonwealth of Kentucky was paying almost the entire cost of voluntarily. As a result of that 2010 legislation, active teachers, retired teachers, and school districts all joined in sharing in the cost of health insurance trusts. As a result of all that increased funding that we're getting for the health insurance trust, that's why we're seeing a cash flow positive result with the health insurance trust. So great news there. I've got some more slides on health insurance as well that I'm going to be sharing in just a second here. So anyway, we have a net cash flow, that's a $297,600,000 and versus $262,800,000 in the previous year. Great news. And then let's look at the investment gains or losses, realized and unrealized, which I discussed in the prior slide. We see that's $288,200,000 for '24, up from the $211,300,000 in the previous year. And again, focusing on those bottom two numbers in the column to the second column from the right of on this slide, you see that first we had assets in the health insurance trust of $2,743,000,000 as of June 30th, 2023, and those increased by about $588 million to $3,331,000,000 in June 30th, 2024. So very healthy growth with the health insurance trust. Asset allocation. This is for the retirement annuity trust as of June 30th, 2024. If you look at the far left column here, you'll see a description of asset classes. What are we invested in here? To the right of that, what was the percentage of assets we had invested in that particular asset class compared to the entire trust assets we held as of June 30th, 2024. Then next to that, we see the target. That's like the bullseye, like we're always kind of aiming at that target bullseye, but we're never going to exactly hit that because we know markets fluctuate. We know the value of assets are constantly fluctuating, so sometimes stocks become overvalued. They become greater weight, just because their value compared to other assets in all your portfolio increase more. So you see the target and the range. You kind of want to be within this range always because you're rarely going to be quite right at the target. So I'm just going to focus on the first line here, the first asset class, but certainly if there's any questions about any of the other asset classes, more than happy to take those. And that top line is U.S. equity. So that's United States stocks. That's what that is. And you can see as of June 30th, 2024, our position in U.S. equity was 40.3%, slightly above the target of 38%, well within the range of 31 to 48%. And I'll just note that every other asset class here is well within the range that's been set by our investment committee. Next slide is the same thing, same format, but for the health insurance trust. And I'll just note here, as with the previous slide with the retirement annuity trust, the health insurance trust asset allocations are all well within the range that have been adopted by the investment committee. Actuarial status. Okay, this is for the retirement annuity trust as of June 30th, 2023. The new actuarial valuations for 2024 that are required by law to be submitted to the General Assembly by November 15th. There's a lot that goes into that. We are still auditing employer reports. We're still getting information from on investment returns and auditing those. So there's a lot of collecting, auditing, reviewing information, compiling that, getting that to the actuary so then they can start looking at all the information that we have audited and reviewed and make sure that they can have the best information they have when they start actually doing the new actuarial valuations. But you can see as of, and I'll just focus on the percentage here at the far right, as of June 30th, 2023, we were at 58.6% funded for the retirement annuity trust. And this next slide I've got is going to show you the projections on how that retirement annuity trust is going to move over the next 30 years. The top line represents the funded ratio, or the top box, I'm sorry. The top box represents the funded ratio of the retirement annuity trust and its unfunded liabilities, starting out from present out to 2053. And you can see that dark blue line is the funded ratio projected by the actuaries based on our 7.1% assumed rate of return for the retirement annuity trust. And you can see that it's flat in the early years. And I use this as an analogy, and it's not an apples to apples analogy, but it's very similar to the financial dynamics. And that is, this is akin to a home mortgage, paying off this legacy unfunded liability. Like with a home mortgage in the early years, everybody knows it had a home mortgage, and you're paying more interest and principal. And that happens for years, and it seems like it takes forever till you finally start paying more and more principal, and it eventually flips. And then you're paying more principal than interest. We see the same thing with paying off these unfunded liabilities, and that's why you see the actuaries projecting this remain flat for the next few years, but not long out. Not very long at all, you start seeing some growth in that dark blue line. You know, if we continue to get the funding we're getting now, and you can see eventually we get to 100% funded, okay? And conversely, with this additional funding, you can see with the kind of bold gold line there, that unfunded liability starts to drop as well. Those other lines you see there, the light blue lines and the light gold lines, the light blue assume the top one, what would happen if instead of 7.1, you got 8.1%? And the bottom light blue line assumes what would happen instead of getting 7.1%, you got 6.1%. And same thing with the light gold lines. It just shows sort of a sensitivity analysis of what happens if you're more or less than the 7.1%. Very importantly, the bottom box, same timeline. Same dynamics there with 7.1% represented in the bold green line. You can see that we will continue, and we know we're going to continue to see needing additional funding over the years, but we can see that there's that point out there when we get this legacy unfunded liability paid off, that the cost to the Commonwealth is going to drop dramatically. At that point, you know, we get closer to the cost of what the Commonwealth pays for Social Security. So it's a very good benefit at a very reasonable cost. The only issue we have, and we have been struggling with all along, is this legacy unfunded liability. And that's most of the contributions, the funding that we get, most of that is going to pay off that legacy unfunded liability. It's not just to pay the normal cost of the system, how much we have to put away each year of a teacher's career. So when we retire, there's enough with that 7.1% investment income to pay the retirement benefit. It's paying off the legacy unfunded liability. So really, really good news there. Real quickly, going to health insurance here just a little bit. I just have a few slides. Appreciate your patience, but this shows what happened before and after the 2010 share responsibility legislation was enacted. You can see that top gray line there. The Commonwealth was paying most of the cost of retired teachers' health insurance, and it was growing. And that was unsustainable. That's when our Board of Trustees directed TRS to get together with education groups, active retired teachers, school districts, superintendents, over a period of a year and a half with legislators, and come up with a plan that resulted in shared responsibility with active teachers, retired teachers, and school district, all contributing more. And you can see as a result of that 2010 legislation, costs for the Commonwealth began dropping dramatically. And as planned, we phased in contributions from active retired teachers and school districts, and their contributions increased. So that's how shared responsibility works. And the results of that, and this is probably the second best slide, or very close to the second best slide here, as we have seen a former benefit, retired teachers' health insurance, it was a pay-go benefit, dollars in, dollars out, becoming a pre-funded benefit, where investment income is doing more and more of the work of funding retired teachers' health insurance. So we've gone from a 3.5% funded plan in 2009 before shared responsibility to 2023, we're at 71.3% funded. That's a big turnaround in really relatively just a few years. It's a tremendous success story. It's a wonderful thing for teachers across the Commonwealth, and it's something they appreciate. And we will continue to see that growth as long as we get full funding for the Health Insurance Trust. Though in a few short years, just a few short years, we'll be at 100% funded. One caveat with that, we need to see health insurance inflation, medical inflation, be in line with what we've seen since 2010. We need to make sure that we can still have access to federal rebates that we're getting now, and also that those federal subsidies, Medicare Advantage, that those remain in place to help pay a large part of the cost of the health insurance. But if those stay in track, this health insurance trust will be fully funded very shortly. Our staff at TRS, we've got some great professionals at TRS that work hard in the very complex world of health insurance. I'm just going to note two things here. You see to the far left, that's the premium, the monthly premium for the Medicare eligible health plan that TRS administers. As for people who are 65 and over, you can see in 2002 the monthly premium was $232. Shifting to the extreme far right of this slide, you'll see that in 2024 those costs are $207. So actually, our health insurance team taking advantage of subsidies and rebates and just doing things, making changes to the plan along the way to incentivize our members, our retirees, to use generics as opposed to brand names, generics that work just as well for them as brand names. They spend a lot of time doing that, and we have a great generic fill rate, and it saves them money and it saves us money. So they've been able to keep those premiums, actually have them reduced from that many years ago. So great news there. There's one more thing. I was asked about federal legislation. I don't have a slide for this one, but like you heard from the other two retirement systems, yes, the Inflation Reduction Act does contain provisions for prescription drug coverage. We are a fully insured, it's called Employer Group Waiver Plan, or EGWIP. Everybody calls it EGWIP. And it's the prescription drug side of the Medicare Advantage plan. So we're getting federal subsidies from that. But the way that the TRS EGWIP is structured, we're not going to see as dramatic of a cost increase with the IRA as the other plans are, because we are that we're structured a certain way. We're not going to see a lot of people who are going to have more than $2,000 out-of-pocket cost annually on this. So not as impacted by that. We are also, as a self-insured EGWIP, we're getting a windfall from the federal government of $15 per member per month on prescription drug costs. So just different dynamics there. We will see some cost, increase there. I will also note that there are several EGWIP providers across the nation. We've been seeking guidance from the Centers for Medicare and Medicaid Services, CMS, on how this new law works. And several of us, many of us actually, are seeking an exemption from some of the applications of the IRA. And that's just a long process. When you're dealing with federal government, there's a lot of communications, there's meetings, there's writings, but we're still, kind of exploring this and seeing this is going to eventually land up for us. And that concludes my presentation. Glad to take any questions if there are any.
We have a couple questions. Senator Nemes first.
Yes, I'm tired just watching you. Can you take a breath for a second?
Well, he started this by saying I'm the only thing that's standing between you and
I
lunch.
think you,
So,
I think you kind of alluded to and sort of answered my question at the end. The prescription rebates. I was under the impression that that went to the providers. So, is that the new law that you're all dancing with?
there's been discussion about that. There's been legislation, out there, proposed legislation about that. Right now, we can still get rebates from the drug companies, and we pass that savings on directly to retired teachers. The plan does that, and that works very well, again, for us. Egg whips are different, and it's particularly egg whips like TRS. We're a retirement system. We have bargaining power. We're differently situated than an individual, but how we are positioned as an egg whip allows us to use those prescription drug company rebates to the most effective manner.
Yeah,
for our
I'm a
retired
little
teachers.
confused because our hospitals are saying they're getting it. They don't want it go directly to the patient, and you're saying you're getting it for the patient. So, is there a distinction or?
I think I'd want to know, the hospitals were saying what? I'm sorry?
They're saying that they don't want to give up those rebates because it would cost them. They don't want it to go directly to the patient.
Okay, well, and we're on the same page with that. We're saying that those rebates should come to TRS, not, we can use those rebates for the patient,
Okay.
It's having to go directly to the patient. It's the same page there. I'm sorry.
Representative Bratcher.
3 real quick ones, and I know we're in a hurry. The shared responsibility, how is that divided? How much do the teachers give? Is there a percentage?
Yes.
What is it, teachers or what?
Good question. So active teachers contributed 3% of their paycheck to the health insurance trust. Active teachers do. School districts match that 3%. And that's something that neither one were doing before. The active teachers were, prior to this shared responsibility, they were contributing 0.75%, 3/4 of 1 percentage point of their pay to the health insurance trust. So now we've added 3% of that for a total of 3.75%. School districts are just doing the 3%. Retired teachers are now contributing in addition to what just the cost of the plan is for everybody, and that ranges depending on the plan you've selected, but in
What
addition.
about the state? Does the state contribute?
Yes, and the state does too.
How much?
Retired teachers under 65 pay the Medicare Part B premium equivalent. The retirees 65 and over pay the federal Medicare. Retirees under 65 just pay that towards the cost of their coverage. The Commonwealth, as part of shared responsibility, went from paying voluntarily almost the entire cost of coverage to paying the cost of retirees under age 65 less what they pay. So that's why you saw in this previous slide just how much, the gray line, it just dropped dramatically.
Yeah, I understand. All right, so the KTR, like the KERS has, non-has, they gave us a funding percentage. What is yours?
Our funding percentage as of June 30th, 2023, 2023, don't have the 2024 numbers, it's 71.3%.
How much?
71.3%.
Okay, so that's pretty good. All right, and then the last thing, I can't remember his bill. Ed Massey had that bill.
Yes.
Has that been around long enough to take effect? What's the overall conclusion you got on that?
Yes, no. So that is in regard to this new tier that we have. We call it TRS-4. It's effective for individuals who become members on or after January 1st, 2022. It is working very well as planned. We are seeing new members in TRS-4 every single year. In fact, our actuary projects that by 2023, half of our active membership will be in TRS-4. That tier does a lot of things. Most significantly, it removes any responsibility for any unfunded liability that might from the Commonwealth for any unfunded liability that might accrue with that benefit. So if any unfunded liability were to accrue in TRS-4, and we're not seeing that right, because it is funded well. That was established on a very well-funded plan. It's a strong plan. It's growing well. We're not seeing an unfunded liability. and we don't anticipate one. Anything can happen. But if there were, for some reason, the Commonwealth would not be responsible for any of that new unfunded liability in TRS-4. Rather, the TRS Board of Trustees, under that legislation of Representative Massey's, and very widely supported here in the General Assembly, would require TRS to take certain actions, their board to take certain actions. So, for example, because it is well funded and we're getting some additional money, we're setting up a stabilization reserve account, kind of like a rainy day fund. The board could go to that first and go, let's move some money from here over here to the pension side of TRS-4. Or they could do other things too. I mean, they could freeze COLAs, they could, adjust benefits momentarily, they could reduce contributions to the savings component of TRS-4. There's contributions going in it. They have a lot of tools that they could use, and I would think temporarily, if it ever did happen, to get that TRS-4 back to 100% funded very quickly.
What about the COLAs? What is the average COLA each year?
COLAs are 1.5%. Those are in statute that are part of the contribution that the members and employer make. The reason that TRS has a COLA at 1.5%, a modest COLA, we are a Social Security replacement plan. And, if you look at Social Security, they award COLAs, year to year based on inflation. We just have a set pegged amount at 1.5%.
Yeah. Okay, thank you very much.
Bo, just one correction. I think Representative Bratcher was asking about the percentage, the retirement annuity percentage funded, and it's 58.6, right?
Okay. I was.
You gave him insurance, right?
I did. I thought he asked. I'm sorry.
Okay.
I apologize. If he said retirement annuity, it's 58%.
Yes.
58% funded.
All right. And our final question, Representative Witt.
Thank you, Mr. Chair. I did want to go back to that actuarial status, that the number, 58%. It sounds like we're going in the right direction, but could you kind of speak to where that number was maybe 8-10 years ago, and just to confirm that we are going in the right direction?
Okay, so again, we had a number of years where full funding was not available in the budget. So we have now, really, we're just starting the 9th year of getting additional funding. So we're still very early on that amortization process, okay? And again, just like with the home mortgage, these early years, and the actuaries projected this from the very beginning, it's going to be like this in the early years, kind of flat. And then we hit that point, which I showed in this other here, the dark blue line, where in just a few years out, you're going to start seeing that increase. But it's not going to increase in the next few years, maybe very little, or it could be flat. And it's projected by the actuary. Our actuary advises other pension plans, the same kind of funding, the same kind of amortization schedule that have been further into the amortization schedule, and you can see improvement. This is what happens when full funding is received. We will get there. And we are, I'll note too, we are using some conservative assumptions here. That we changed a lot of our actuarial assumptions a few years ago as a result of an experience study that ended for the 5-year period, June 30th, 2020. We changed the mortality tables. So very significantly, we went from a general population mortality table to a teacher-specific mortality table, which they live longer. So that increased liabilities. We also, our actuary put in place a generational mortality table that assumes that someone who is 25 is going to live longer than someone who is 55. So we really changed mortality tables, and then also very significantly, the actuary changed our assumed investment rate of return from 7.5% to 7.1%. So what I'm saying is we have placed some very conservative actuarial assumptions. I don't anticipate the mortality to change a whole lot, but you saw with that slide showing the 30-year returns, 8.1%. We're a long-term investor, so we beat the assumed rate of return by a percentage point. So we're very optimistic. I mean, not optimistic. We know that the full funding continues as it has now in these last budgets. We will pay off that unfunded liability, and TRS will be 100% funded, and the cost for the Commonwealth is going to be slashed by more than half.
Thank you.
All right. Well, don't see any other questions, Bo. You've said egg whip too many times. I'm hungry. So all in favor to adjourn, say aye. Aye.